Today, we are back with Sonia Vovan, and she is here to talk with us about dysautonomia because October is Dysautonomia Awareness Month. You might remember her from episode number 40, where she talked all about the vestibular system. Honestly, that's one of our most popular episodes, I think, because you broke it down in such an amazing way that was so helpful. And I'm always directing people. Just last night, we had our Zoom support group for the month. And I was telling people, hey, you should go and listen to this episode on the vestibular system. And so I'm so glad to have you back. Welcome back.
Thank you so much for having me again. And I'm happy to speak about dysautonomia since many of my patients experience that.
Yeah. So can you start off by sharing a little bit about you, some of your background, your education?
Yeah, definitely. So I'm a physical therapist and I do specialize in vestibular rehab, like you mentioned. And I'm based in Toronto, Ontario, Canada. Just recently this year, I've actually reduced my clinical work because now I'm back in school 10 years later. And it's because I'm studying the effects of sensory motor changes after a concussion. And that can include vestibular changes, but that can include visual and proprioceptive changes as well. So, being a clinician, I realized, where are the gaps in research and knowledge? And so now I'm going back to school to kind of help fill those gaps again.
That is incredible. We need people like you. I'm always saying on my podcast, if you're seeing a practitioner that is not up on current research, that, isn't learning still, you should find a new practitioner. Because there are people out there and they mean well, but there are, physical therapists and vestibular therapists that are still practicing what they learned 10 years ago, not realizing that the research has changed. So that is so cool to hear that you are learning more. It's incredible what you do for your patients.
Thank you so much. And yeah, I agree. Like things are changing like all the time and there's always new approaches. And yeah, sure, we can stick with the ones that we know well, but if something works better and is more efficient, then why not, right?
Yeah, absolutely. So let's go into this conversation about dysautonomia. Let's just start with the basics. What is it?
Yes. Okay. So dysautonomia, also known as autonomic dysregulation, let's take it back even further. So, what is the autonomic nervous system? So, I would say just based on the word autonomic, you can think of it as the system that's related to regulating automatic functions. So, things that we don't even have to think about. It just helps us survive. It's reflexive, but it does have a major impact on almost every system in our body. So, our cardiovascular system, our respiration, our digestion, bladder, temperature, I can keep going. Basically, anything that you don't have to have put a second thought to, that's what it's related to. And there are two major subsystems. So, there's the sympathetic and the parasympathetic nervous systems. And the easy way to think of them is that the sympathetic nervous system is related to your fight or flight response, your stress response. And the parasympathetic nervous system is your rest and relaxation response. So, what you do at the end of the evening when you're relaxing. And the major regions of the brain associated with the autonomic nervous system is the cerebellum and the brainstem. And those regions are related can be impacted after a concussion or a whiplash injury because of the rotation forces, the acceleration forces. And so that's why after a concussion or brain injury, you can have dysregulation of the autonomic nervous system that can result in a wide range of symptoms.
That's so good to know. So, how common do you think dysautonomia is in concussion patients?
So I think it's more common than we think just because of the wide range of symptom presentation. So of course we think of, the most common one, POTS, so postural orthostatic tachycardia syndrome, but there's such a wide range in terms of milder forms of that. There's even other conditions related to autonomic dysfunction. And so even, a symptom like like headaches, right? Or migraines. They even come from, milder and more severe forms. So I think that there is some sort of autonomic dysregulation in most concussed patients. It's just a matter of the severity.
Yeah, that's really important to hear and to know, because I think it's hard, or it has been hard for people to maybe get the diagnosis or figure out, do they even have this? I know for me, it was always written off because I didn't have POTS. So I wasn't actually, passing out. And can you explain like what some of the symptoms of POTS are versus some of the milder forms of dysautonomia?
So specifically POTS, so postural orthostatic tachycardia syndrome. So that means that with changes in posture, specifically changes so that you're against gravity, so you're usually standing upright, you have an increase in heart rate. And for POTS to be diagnosed, it has to be greater than 30 beats per minute from a lying to a standing position. So that's quite a significant change. But in many of my patients, I've seen increases of, 15, 20, 25. They're so close. And then when they're in that position, they can feel those symptoms of, headaches, lightheadedness, heart palpitations, feeling dizzy and off. But again, it's just not enough to be diagnosed. But of course, it's affecting their ability to function daily. And then imagine if they're standing and they still feel that way 10, 15 minutes later, how can they feel like they can do their daily activities with those symptoms still happening? So that's what distinguishes POTS, but it doesn't mean that you may still be experiencing orthostatic intolerance.
Yeah, that's so good. And that describes what I have had and what I've got diagnosed with. Like, I think my difference was 20 beats per minute. So it wasn't enough to be POTS, but it was enough that I would go from seated to standing, from laying down to standing. And my physical therapist sent me to a cardiologist for this. And so he did a tilt table test, and I did a Holter monitor and EKG, I think. And through that testing process, he was knowledgeable enough to be able to say, well, you don't have POTS, but you do have dysregulation. And so he diagnosed me with dysautonomia. And this was just a little over 3 years ago. Yeah, a little over 3 years ago. And I had been living with those symptoms for over 10 years. And I didn't know that it wasn't like, I didn't know that everyone didn't feel like they were dying when they went up the stairs. Like, I didn't know that, I thought I was out of shape. I didn't know that that wasn't a normal response. I also misinterpreted my heart rate as anxiety. So I was trying to get
Yes.
psychiatric help because I thought that I was anxious all the time, but I couldn't get to the root of it in therapy because it was actually my body was in fight or flight mode. But my mind, I didn't have any psychiatric or psychology. I don't know what the right word is, but I didn't have, a lot of anxiety in terms of my mental health, but my body was on edge all the time. So I was like constantly anxious. And so I misinterpreted dysautonomia as anxiety. And, I was always on edge and I felt like I was out of shape. I couldn't walk for any length of time without feeling like I was just like dying. Like, literally, I felt horrible. And I also didn't realize that feeling lightheaded all the time wasn't normal. I just was lightheaded all the time. Like, standing up, like I would just feel so out of it constantly. And I thought, and I've said this before on the podcast, but I think it's worth repeating. I thought that brain injury was enough of a root cause for these symptoms. So I spent many years going, yeah, I feel off and I know there's something off, but it's because of my brain injury. Now I know, and I'm trying to educate everyone on the podcast that, like, I don't want you to struggle for over 10 years like that. Like I did. Like, if you're having symptoms, your brain injury most likely put into motion something else. And so if you feel like you can relate to any of these symptoms, it's possible that you have a form of dysautonomia.
Yeah. And you know what? I'm so glad you mentioned the anxiety component because that is something that I hear from many of my patients, especially because I do focus on the vestibular component of therapy. So that's when, my patients experience vertigo, like strong vertigo and dizziness, and then they feel anxious as a result of that. And they wonder, it's almost like the chicken and the egg, like, what came first, right? And they do feed off of each other. They definitely do. But then they always say, like, okay, so now that my vertigo has been resolved, I still feel anxious. Like, why could that be? And it may be because this process of dysregulation has fed on itself and then resulted in these residual symptoms that feel like anxiety, even though it may not be. So I'm really glad that you brought that up. And, another way that I kind of describe, like, the mild and severe forms of dysautonomia is kind of like a muscle strain versus a muscle tear, so a muscle tear is obvious and you can, see that and feel it and have, clear dysfunctions with that. But a muscle strain, you may not see it, but then you obviously still have pain. You obviously still have symptoms and you obviously still can't function with that muscle strain. So, just because you aren't diagnosed with POTS doesn't mean you aren't experiencing dysautonomia.
Yeah. And I think I've lived with dysautonomia for many, many years, and I know firsthand that it can feel debilitating. And it was so freeing for me to finally know what it was and to realize, oh wait, I don't have to live like this forever. Like there's a reason for this. It changed my life. But even if you have like a form of dysautonomia, every time you go from seated to standing, you get lightheaded. Your heart rate spikes. You feel off. Your blood pressure drops. And you constantly are feeling like off. And it's hard to regulate your fight or flight mode because your body kind of gets stuck in that stress mode. And for me, dysautonomia also caused issues with my gut because I wasn't able to be in the rest or digest. And so I was having constipation and all these other problems, not to be TMI, but it's true. And I had no idea that it was related. And so it's amazing to find this out and to realize, oh, there's actually something you can do. And, but you can't see it on the outside.
Exactly. And especially, let's say you may have had digestive issues in the past or other, sleep issues in the past, right? But it's possible that after a brain injury, it can exacerbate those issues and maybe perhaps even worsen your symptoms of dysautonomia. So then let's say if you've had a previous gut issue and then after your brain injury, you experience those symptoms again and you just attribute it to your gut issues. It could be actually that the brain injury exacerbated those symptoms. And so it's really important to, when it comes to dysautonomia, address those metabolic issues from the get-go, whether you've had pre-existing, autoimmune conditions, inflammatory conditions, maybe underlying infections, because having that still being present, affecting your nervous system can also worsen your dysautonomia.
Yeah, I'm so glad you said that. So, does dysautonomia ever come outside of concussions and brain injury?
Yeah, definitely. And I would have to say it's kind of outside of my scope since, as a physical therapist, I don't normally deal with dysautonomia if it's outside of physical trauma, physical injury like a brain injury. But I have seen it in those cases, and especially right now with viruses being prominent, it has been a major secondary effect of viral infections.
Yeah, so there's a lot of different causes that could cause it to happen. And of course, we're talking about concussion and brain injury because that's where we're at and what we're talking about. But I also wanted people to know, like, it's not only present in brain injury, but it's very common. So if somebody's listening and they go, I think I have that, what advice would you have for them?
So I would say definitely see some sort of brain injury, concussion practitioner who has experience working with patients with autonomic dysregulation. There are very basic clinical tests that can be done even before doing the tilt table test. So, for example, myself, just assessing their pupil response, if it dilates and constricts, checking their vagus nerve function, checking their respiration, like how well their ribs expand, their skin color, just touching their skin for their temperature, their pulses. So basic tests like that can be done by many types of clinicians. And if there is some sort of dysfunction with those tests, then there could be an indication that autonomic dysregulation can be present. But of course, then you want to be tested with the tilt table test. So whether that's a cardiologist or any other practitioner who can conduct that test. And then when you see a clinician who is well versed in dysautonomia and they determine that you have dysregulation, there are many ways to manage it depending on the cause. So, of course, the goal is we want to stabilize your nervous system. We want you to be able to fluctuate between a stress and a relaxation response easily. We don't want it to be a delayed response or experience residual or lingering effects. So we want to basically achieve, equilibrium with your nervous system. So, I always say address those metabolic issues first, because if they aren't, then your body just isn't primed. It isn't ready to heal. And then where someone like myself will come in is that I would help with providing neurological rehabilitation to help normalize those inputs to your brainstem and cerebellum and your brain again. So depending on your deficits, it could be ocular motor therapy, it could be vestibular therapy, which I find is often the case. It could be balance exercises, coordination, cognitive exercises. Wherever your deficits may lie, we just want to provide input to your nervous system to help normalize everything again. But the most important thing is that these types of therapies have to stay within your limit. So, we don't want to push your nervous system when it's already under stress. So it could be a very slow, gradual process of rehab, and it may take some time, but it's really important that we stay within your specific threshold. And your threshold will be different from someone else's threshold. And not only that, but your own threshold may change day to day. So it's really important that therapy is specific and individualized to you and your specific case.
Yeah, that's so good. Okay, I have a couple thoughts and questions based on everything you just said. So The first thing is, when I got diagnosed with the cardiologist, all he said was, eat more salt and do some exercise every day. And that was all they gave me. And I think that was all he was capable of giving me. But I ended up not too long after that seeing Dr. Jeremy Schmo at the Functional Neurology Center. And he's the one who really helped me to rehab out of the dysautonomia. And so we approached it with balance and vestibular. And what's interesting is I had done vestibular therapy a couple years before that. And I think it made me worse because they were pushing me so far beyond what I could tolerate. I would feel nauseous and I would feel horrible after my vestibular therapy and doing my exercises. And it just wasn't the right thing. It made me worse. And so when you said do it within your limit, that's super important. I had never been instructed to work out within my limit. And so ever since I started, and you mentioned viruses. So I had COVID at the beginning of this year, and it caused my dysautonomia to have a major flare up. And so this year has been pretty difficult health-wise for me. But I started over the summer, once I felt a little bit better to tolerate, doing low-level cardio, like elliptical for 15 minutes. I couldn't do more than that. And I didn't, you think it's not going to make that much of a difference, but it actually made a huge difference for me in regulating the autonomic system.
Exactly. I mean, ultimately, our body wants to stay in homeostasis, right? We always want to be in a state of equilibrium so that we can just survive and then obviously optimally function. So in order to have that stability, we need oxygenation, nutrition, proper blood flow, but that can be impacted if we stress our systems out, right? And stress can come in physical, mental, emotional sources. So it's not just, I think when people think of stress, they think of the emotional component, but physical stress can also have an effect. So that's why, when it comes to rehabilitation or exercise, we don't want to stress out our nervous system. So, we have to think about all the different inputs that are going, like that are being given to our nervous system, whether it's from, the visual, vestibular, balance, all of those different types of inputs. We want to think about what we are giving to our bodies, how often a day, how many times a week, how long it's happening for, because it all has a cumulative effect to how our nervous system responds to them.
Mm-hmm. And this goes for someone even who maybe doesn't have dysautonomia, just a brain injury survivor in general.
Exactly. I agree. I think that's a good principle to kind of be mindful of as you go through your brain injury recovery. And then, that limit that you set for yourself will increase over time as you build your tolerance.
Yeah, that's so good. So my other question was, you said the first thing you want to do is address metabolic issues. Mm-hmm. So can you actually explain what that means?
Yes. Okay. So again, as a physical therapist, it's not totally within my scope, but basically with metabolic issues, we want your body and your nervous system, again, to be in a state of stability. And so we want, proper blood flow, proper nutrition, oxygen going up to the brain. And that means that all of our other systems have to be in sync in order for that to happen. And so if there is an underlying autoimmune condition, infection, inflammatory condition, that can have an impact on those metabolic functions. So, no matter how many vestibular exercises you do, it's not going to work if your body isn't primed to take those inputs, isn't ready to oxygenate those nerves in order to improve on vestibular function. So as a physical therapist, what I do is if I see potential symptoms and signs of metabolic dysfunction, I will often refer them to perhaps a naturopath, if a physician, if it's an infection, a functional medicine practitioner, someone who can address those underlying metabolic issues. And then once their body is more primed to heal and recover, then I know that the rehabilitation that I will provide will be more effective and the patient will be able to respond more positively.
Yeah, it's so important. And I feel like this happened backwards for me because I struggled for so many years and I've only been addressing the metabolic stuff the last couple of years. And it's changed my life. Like my whole life has changed since I have really addressed the nutrition and really, I'll just give an example. And I was a vegetarian when I got my brain injury, and I was a vegetarian for 7 years, and I was anemic. And vegetarian didn't work for me. It wasn't, but I didn't realize till years after I had my TBI that I needed animal protein for my brain. And I know some people prefer to be vegetarian or vegan. That's fine as long as you're getting the nutrients, but I wasn't. And so I actually think my brain maybe didn't heal as much at first because it wasn't getting the nutrients it needed. Because if I'm anemic, I'm having issues. And so, but everything just feels chaotic when you're in those stages. It's like you don't know what end is up. Like I remember just being in survival mode. Like I couldn't even picture getting through the day. And so when you're in that state, it's a lot harder to address some of these things because you're like, I just have to barely function. I can't even think about going gluten-free. I can't even think about and so I just want to encourage people to give themselves grace. But when you're ready and if you are able to address these things earlier on, you'll have a smoother trajectory in your recovery. The other thing is hormones. I just did the Dutch test 2 months ago, and it's life-changing. I didn't know that I had hormonal imbalances, and now I'm addressing those. And my doctor actually thinks that I see a functional neurology trained chiropractor who also has certifications in nutrition and hormones, and she does nutritional and hormonal counseling for people. And she said that she thinks because I had dysautonomia for so long and I was in fight or flight mode that caused my cortisol levels and my hormones to get off. And I had never heard anybody connect those before. Is that something that you would think about?
Well, exactly. That's the case because a lot of these automatic functions that are performed by the autonomic nervous system, they rely on hormones and they rely on optimal functioning of those hormones. So I'm glad you brought that up because that's another area that needs to be addressed as well. And many underlying like inflammatory conditions are also related to hormonal imbalances. So again, if there's something that clues me in that there is a hormonal imbalance in a patient, I will have them address that first before anything else. Because like I said, if those basic functions are not in place for you to heal, then your body won't want to heal, right? Like, being able to survive is our primary function. And we just want our bodies to be able to stand up straight, to see, and just to move through your environment. So if you can't even do that, and then you add on top of that all the stresses of other rehabilitation exercises, it's not going to accept it.
Yeah. And I'm so glad to hear you say that too, because I get so many people in my support group and none of their practitioners are addressing anything metabolic. They're just focusing on the cognition. And that was me for so long. And it's so freeing for me now because I did so much vestibular and neuro rehab stuff and I could never shake the fatigue. And I just like, and now I find out that my hormones are off. And my doctor looked at my Dutch test results and she was like, you're probably really tired all the time. Look at your cortisol levels. They like literally spike and drop like really fast. And I was like, oh my goodness, no amount of neurological therapy is going to help a hormonal imbalance. And so no amount of brain therapy. And it just made me feel better because I kept being like, what's wrong with me? Why doesn't the therapy work? It doesn't work for me.
Yeah.
And I feel like a lot of people feel like the brain injury therapy isn't working. If it doesn't work for you, there's probably something else going on. And
Yes.
so, yeah. And I didn't know that dysautonomia can cause cortisol issues that can cause hormonal imbalances. And so if anybody has dysautonomia, I highly recommend connecting with some sort of practitioner, like Sonia said, a functional medicine or nutrition or naturopath or somebody who could maybe do the Dutch test and or other testing that they recommend to help you figure that out on what's going on metabolically.
Yeah. And you know what? This is a good point to even say that any clinicians who are listening or watching this, if your therapy also isn't working as you think it should be, or this patient's symptoms and their dysfunctions are more prolonged than you anticipated, you need to rethink what you're doing or have a different approach on it. Like I think it's okay to admit if your therapy isn't working and to have someone have a different, a different perspective on it. I would say that with myself, like earlier on in my career as a physical therapist, I may not have attributed persistent symptoms to dysautonomia as often. But now that I've learned more about it, and again, learning is such a crucial aspect of being a clinician and evolving as a clinician, I've learned now that dysautonomia is such a prominent issue in my concussed patients. And since I've made that click, that change in my perspective on how I approach my patients, I've had much better results. And it doesn't mean it's something that I have changed in what I do in my rehab. It's the fact that I now refer more of my patients to other practitioners who can deal with those areas that I can't address, like the metabolic issues. And then when they come back to me and then I provide the same neuro rehab that I always have, my success rate has gone up, definitely.
Yeah, that's incredible because, the brain affects everything. So like all of our systems and all of our systems integrate together, but it's like, you can't address things in isolation and think that, with a brain injury and think that it's going to work. And that has been the approach, I think, for many years in brain injury rehab. And I'm glad that it's changing. But I don't know if the general practice has yet caught up to the research. So it is very important to see a practitioner that is able to know on the current research and realize that there's more than just neurological things often going on.
Exactly. And I also think then as a patient, I know it may be tough too, but to advocate for yourself, like, of course, you put a lot of trust in the practitioner and, you're trusting that what they're doing is going to work for you. But if you feel like something is off or it's taking longer than you would have thought, or despite, doing your exercises as they've been prescribed and, you've been very consistent, if something isn't changing, as best as you can, try to advocate for yourself. And that's why I created my Instagram page, because I want individuals out there to know that if something feels off and something is feeling like it shouldn't be and others can't see it, it is important for you to advocate for yourself so that you can get the right therapy. It's really hard to be able to explain yourself when they can't see what's going on. And that's a huge part of dysautonomia, right? Like, you feel the lightheadedness, you feel off, something doesn't feel right, but someone from the outside won't be able to tell.
Mm-hmm. And sometimes even you can't tell. Like, I didn't know until I knew, but I was just like, I'm lightheaded all the time, but that was my normal. So it's like, you go with something for over 10 years, you don't think about it as not being normal because it's your normal. But just because it's your normal doesn't mean that it's okay. It doesn't mean that it's how it should be. You don't have to live like that. And so it's, but it can be hard to even recognize it in yourself. So, like we said, you got to take the little steps and just, address one thing at a time. But yeah, so anyway, anything else you want to share about dysautonomia before we go today?
I think that besides seeing a practitioner who has experience working with patients with dysautonomia, some things that you can do immediately to help address some symptoms could be, like just making sure that you engage in a breathing or meditation practice to help, activate that parasympathetic nervous system, that relaxation nervous system, and just giving yourself grace and allowing yourself to engage in low level activities so that you help, boost blood flow to your brain, which is most important. So I think there are little things that you can do in the meantime to help you on the right track. But obviously, seeing a practitioner who has that experience is the most important thing.
That's great. So, any final words of hope and encouragement for our listeners today?
So I think that if you feel like something is off and you feel like something doesn't feel right, it's important for you to speak up and to advocate for yourself so that you can get the right treatment. Because if, you've addressed the major symptoms that you had from your brain injury and you feel like just that there's a little bit of something that's off, it could potentially be dysautonomia. And there are treatments for it that can help address that area.
Wonderful. Thank you so much, Sonia, for taking the time to be here today. So you mentioned your Instagram earlier. Can you share what your Instagram is and your website if people want to get in touch with you?
Yeah, definitely. And my Instagram handle is All In Your Head PT, all one word. And my website is www.soniavovan.com. So my name. And so I work with individuals one-on-one in the clinic. I also do virtual telehealth consults. And so I'm happy to speak to anyone further about vestibular therapy and dysautonomia.
Wonderful. Thank you so much. And I'll put that contact information in the show notes for everyone.
Thank you so much for having me again.
Yes, thanks for coming back. I really, really appreciate you sharing your wealth of knowledge, and you explain it in such a easy to understand way. So I appreciate that a lot.
Thank you.